Hi, I'm Dr. Sherry Lofton, family physician at Inova VIP 360. You may be familiar with back pain. It affects 80% of adults at some point in our lives. That back pain can range from mild to self-limiting to severe and disabling, affecting quality of life and employment. At Inova VIP 360, one of our goals is to help patients prevent back problems. The following video by Dr. Ali Ganjei presents ways for you to avoid back issues.
Hi, I'm Dr. Ali Ganjei, Co-Medical Director of the Inova Spine Program. We all have heard the saying, an ounce of prevention is better than a pound of cure. So today, I hope to review with you over the next 10 minutes the anatomy of the spine, how the spine moves, as well as what we can do to minimize injury to our spine and maintain the health of our spine. Back pain is one of the most common reasons for patients visiting their doctors. 80% of Americans will experience at least one episode of back pain in their lifetime. It is the most expensive healthcare problem in the age group 20 to 50. It is also the most common cause of disability in the age group under 45 in the industrialized countries. Common risk factors that can lead to spine pain is obesity, smoking, poor posture, sedentary jobs, lack of regular exercise, as well as repetitive improper lifting. So here is the anatomy of the spine. We're looking at the spine from three different angles. This is the frontal view, this is the side view, and this is the back view of the spine. It is a fascinating structure, and it is a very complex structure, but to simplify it, we can look at these bones that are sitting on top of each other, and the blue structure that you see in between them is a disc. Disc is like a jelly donut. It has a wall all around it, and it has jelly in the middle. And in the back of the spine, we have this cage of bone where the spinal cord is housed. And then there is a window on the left and a window on the right at each level that we have a disc. And these windows are for the nerve roots to come out of the spine. Each nerve root is destined to supply a specific muscle group, a specific area of the skin. So this is a magnification of two of those bones and one disc in between them. This slide shows bending forward and bending backwards. And what happens to our spine when we bend forward, and what happens to our spine when we bend backwards? So when we bend forward, the front part of the bone is coming closer together, as you can see here. And the gel moves from the front of the disc into the back of the disc. Now, this is the window that we were talking about, but you don't see the nerve root coming out of this window because it's not demonstrated in this slide, but we'll see it in the next slide. So 90% plus of the damage that occurs to the disc wall occurs to the back wall of the disc. Not because the back wall of the disc is weaker than the front wall of the disc, it's because we live in a world where we're constantly bending forward or sitting with no back support. Most household furniture, for example, has poor back support. A lot of people have ergonomic chairs in their office, but if they're not sitting all the way back against the support, their spine is compromised, and the pressure is falling in the front of the disc, and the jelly is just pushed against the back wall of the disc. Eventually, the back wall can crack, it can stretch out, and then once that happens, it goes into that window and hits the nerve root. So Sarah's going to demonstrate how to lift improperly and properly. Go ahead, please. Okay, so this is improper lifting because the box is too far from her body, and also she was lifting with her lower back. Let's try that again. So as you see, the muscles of the back are doing most of the work here as she's lifting. That causes straining of these muscles, and also because the pressure is falling in front of the discs of the lower back is pushing the gel against the back wall of the disc, and that can cause a disc herniation. So now we're going to demonstrate the proper way of lifting. So she's bending with her knees, bringing the load close to her body, and then lifting up with her knees. So this takes the stress away from the lower back muscles, and also the discs in the lumbar spine are safe. So always remember, bend with your knees, not with your back, so to minimize the chances of injury. There's also two joints in the back of our spine, one on the left, one on the right. These are called facet joints. And facet joints can develop arthritis. If we're not following correct body mechanics, if we're not exercising regularly, if we're not participating in exercises that help the health of the spine, these joints can develop arthritis. And the arthritis can make the joint enlarge. An enlargement of that joint can also compromise the nerve as it's coming out of that window. Here we're going to demonstrate how we can correct improper ergonomics for someone who is working at a desk on a computer terminal. As you can see here, Sarah is sitting without any lumbar support. Her lumbar spine curvature is so that there is constant tension in the muscles of her lower back, and that can lead to strain of those muscles. She also is in a situation where the pressure is falling in front of the discs of the lumbar spine and pushing the gel away against the back wall of the disc. The other problem is the computer terminal is too low, so she has to bend her neck forward at all times, and that can cause stress in the muscles that are behind the neck and also compromise the cervical spine discs. The other issue is the leg has to be touching the ground and be supported by the ground at all times. In people with shorter legs, we need to use a shoebox or a telephone book to take care of that problem. So this chair has adequate lumbar support, but as long as Sarah is not all the way back against that lumbar support, her lumbar spine is not being supported. So we're going to ask Sarah to scoot backwards now. Okay, so her spine curvature is now such that there is no tension in the muscles of the lower back. Now we also have to raise the computer screen to the point that she does not need to bend her neck forward at all times. So now the tension in the muscles of the neck are also reduced. As you can see, her foot is touching the ground and is adequately supported, and the angle of her elbow and shoulder are adequate. Many times people use a soft wrist support when they're using on the computer terminal as well. I hope these points are helpful, and they can make a big difference in prevention of injury for those who work at a desk on a computer terminal. Now, the spine is stabilized by the muscles that surround it, but there are layers of muscles that surround the spine. Here we see the outermost layer of the spine muscle. They're bigger and thicker muscles. Now, if we peel the outermost layer, we look and the muscles are getting thinner and smaller. And then here is the innermost layer, which is right adjacent to the spine. And those muscles are very small and very thin. If these muscles are not strong enough, if they don't have the endurance, they can easily strain. Strain of a muscle simply is a diffuse micro tear of the muscle fibers. That can happen if we sit the wrong way for an extended period of time without lumbar support. It can happen if we bend the wrong way, lift the wrong way, and we will see more about that. So here is a magnification of two of those vertebral bodies that are sitting on top of each other with the disc in between them. And as you can see, the disc is ruptured here. The wall is broken and the gel is pushing out. And this is the window that I was talking about before. And as the nerve root is coming out of the window, the gel is pinching on that nerve. And that can cause pain go down the leg if the herniation is in the lower back. If the herniation is in the neck, the pain can go down the arm. It could be numbness, tingling, weakness of the muscle. It can be a very serious problem. So prevention is the key. This is an MRI picture of the lower back, which shows a major disc herniation. You're looking at the normal discs here on top, but this is a major disc herniation that is at the L5 and S1 level. Now, this herniation is obviously pinching nerve tissue, and this can happen if somebody bends forward to pick a heavy object, and that causes, as we said, pressure in front of the disc, and the gel is pushed against the back wall of the disc and has ruptured the back wall. This picture shows a condition called spinal stenosis, meaning narrowing of the spine. So in older people, this condition happens, and the structure becomes narrow, the canal becomes narrow, and the windows become narrow because the structure is enlarging, the joints are enlarging, the discs are collapsing. And again, we can prevent this by following correct body mechanics at all times and then performing exercises that aim to stretch and strengthen the supporting muscles of the spine. Those are very simple to do, they don't take that much time, and they're easy to learn and do. So once back pain occurs, an evaluation is critical. Early intervention is the key. For pain management, we can do a lot of different things, but these are passive treatments. They only address the pain, but they don't address the root cause of the problem. We can give medications that temporarily alleviate the pain. We can do manipulations, massage, traction, acupuncture, injections, but that is just a temporary fix. It's like spraying perfume on body odor. It doesn't get to the root cause of the problem. But to address the root cause, we have to have an active approach. Number one, following correct body mechanics. And that is not that difficult. It just takes a lot of discipline so that every time we sit, we have to make sure that our spine is in proper position and there's a proper back support as we sit, whether it's at home or in the office or anywhere. Also, anytime we're bending down to open a bottom drawer, anytime we bend down to pick up an object, we have to do it properly. If we don't do it properly, we may not get hurt that time, but the effect is cumulative. In other words, we could violate correct body mechanics several times and nothing happens, and then suddenly it doesn't take much to herniate a disc. Majority of the time when I see someone with a major herniated disc, the story that they tell me is that, oh, I bent down to pick up my coffee mug from my desk, or I was walking to my car and I sneezed. How did that happen? Well, not following correct body mechanics for an extended period of time led to that. So that's how much we need to emphasize correct body mechanics at all times. Secondly, we all need to participate in simple exercises that don't take a long time to do, that aim to stretch and strengthen the supporting muscles of the spine. Those are easy to learn. Number three, generalized aerobic exercise is good for the health of the individual, and it's good for the health of the spine. And lastly, good nightly sleep is important. So this slide shows improper lifting versus proper lifting. As you can see here, the muscles in the back are compromised as they're being pulled, and also the disc, as you saw in the previous slide, the gel is now being pressed in the front of the disc and is pushing the gel backwards against the back wall of the disc, ready to be ruptured and then push on the nerve roots. And here it shows the proper sitting. You see the shape of the spine is S-shaped here. As we're standing, the shape of the spine is easy to maintain in the S shape. But as soon as we sit, if we don't have adequate lumbar support, the spine becomes C-shaped. And that causes constant pressure in front of the disc, pushing the gel backwards, causing bulging of a disc, herniation of a disc. So these are some of the exercises that we can do for maintaining the strength of our back, upper back, lower back, and abdominals, as well as mobilization of our spine for health maintenance. And lastly, these are the stretching exercises that can be done. Just remember, exercise has to be done under supervision of a healthcare professional before you can do them on your own. because inappropriate exercise can hurt. And also exercise has to be customized for each individual. And exercise has to be done in a progressive manner. So you gradually increase the intensity of it in order to maintain the health of your spine. I hope this short segment has been informative. If you ever experience back or neck pain, or if you have any questions, your primary care physician is an excellent resource to start with. And always remember, even mild cases of back and neck pain can be serious, and early intervention is the key.